our project is a treatment of stroke. We got some very interesting experience. We are going to publish it with acute stroke, with allogeneic mesenchymal stem cells. And now to work with autologous stem cells is not easy, because stroke patient is usually rather old, so more than 60 years. So it's very difficult to obtain good stem cells from their bone marrow. So that's why one of the reasons to use allogenic stem cells. And of course it's getting younger. Taking allogenic mesenchymal stem cells from younger donor could help the patient get younger. Our doctors and our cell culture specialists are working together. So here you can see some clinical trials in our center. The most interesting one, I guess, for you is the study with critical limb ischemia. We used local application of mesenchymal stem cells, and these are some results. So you can see a scintigraphy before. It's a critical limb ischemia here, and after 3 months the microvasculature is much more better. It was not a surgery, it was just local application of mesenchymal stem cells, local injection. So currently the total amount of patients is 16, and the improvement of clinical status obtained in all patients, 90% of patients escape amputation. You see the statistics, it's about 40% of amputation in critical limb ischemia. So basically the paracrine effects are the biggest effect for mesenchymal stem cells application for various diseases. So how long can you cultivate mesenchymal stem cells? To prove it and to investigate it, we use 2 types of karyotyping. We use microarray karyotyping, very sensitive kind of karyotyping, and M-fish. And here you can see some results of M-fish. This is normal karyotype, and this is translocation on chromosome 4, which was revealed after 4th passage. So our opinion is, especially for mesenchymal stem cells, that it should be used for clinical application not more than 4 passages. We investigated the distribution of mesenchymal stem cells. So basically we use at least 2 approaches: local injections, as I already said, and systemic injection, intravenous. So after intravenous injection, of course, the majority of cells accumulated in lungs. But even after 2 hours, cells start biodistributing. So you can see those in brain, in limbs, and of course some of them can migrate into heart. So you know, it's a very well-known phenomenon of homing. So cells can migrate into hypoxia side, into inflammatory side, because of SDF1 alpha and other chemokines gradient. We try to monitor how long allogenic stem cells can survive in donors. It's rather difficult to do on humans. We use GFP label cells, and we reveal that allogenic stem cells, mesenchymal stem cell, can survive at least 2 months.
And previously, we've done several collaborative studies with Dr. Oyashiki, who is a former professor of Department of Hematology in our university, regarding the immunological analysis on chronic myeloid leukemia patient, regarding the immunological analysis of CML patient. That's why we have a chance to take over his industry academia cooperative study with Kintaro cells. Mesenchymal stem cell MSC possess immunoregulatory and tissue regenerative properties. Due to these properties, together with low immunogenic potential and also no tumorigenicity, MSC has great attractive interest in the field of regeneration medicine. It is impossible to expect that your donor is covered, all cells in donor covered by the MSC-derived cells. But still, MSA has still some kind of therapeutic effect. That's the reason is that derived due to the production of trophic factor in a paracrine manner. So people generally think that the reason why MSC is effective is due to the production of trophic factor as shown here. Some of them is a growth factor, and some of them is a immunosuppressive cytokine, and also some of them is a tissue regenerative factor, like here. And Kintaro cell is also one of the bone marrow derived MSC, actually super MSC. And indeed, Kintaro cells has been applied to many Southeast Asians with great clinical success. And recently, Dr. Oyashiki's group evaluated the quality of Kintaro cells and compared their effect on tumor growth and angiogenesis between young and old donors derived Kintaro cells. The therapeutic effect afforded by MSC transplantation is related to the dynamic paracrine interaction between MSC and host cell. In the present study, we aim at developing a novel method to prepare super MSC. Kintaro cells have been already applied to many Southeast Asians, so with great clinical success. That's the reason why we got interested in Kintaro cells. So this is our own study.
Research with Kintaro cells power, we evaluate the quality of novel BMSC, bone marrow stroma cells derived from healthy donors.
Also, the commercially available bone marrow stroma cells, like Lonza, we do not have information the age of the donor patient, donor individual. So the key point, we can identify the age of donor in the Kintaro cells. As you know, the bone marrow stroma cells do not have immunogenicity, so that we can use it very easily.
So as we know, as we age, the source of stem cells inside our body depletes. And the depletion is many factors that's ongoing. We know that as the cell age or sort of differentiate, they start to actually become, the telomerase activity sort of stop. And that means the telomere becomes shorter and shorter and shorter until it stops, and then they need a new cells to come and replace them. And what we know about the mesenchymal stem cells is they have somewhat of a telomerase activity, and in fact that means these cells maintains its youth. Another case here, cirrhosis of liver, in fact with a lot high levels of the liver function test that's sky high, and after 2 weeks of this treatment, the liver function test is improved. Of course, after 3 infusions, the blood test was normalized. So we do know stem cells is very potent for cell healing and tissue healing, for its angiogenic effects. We know it does replace damaged cells that has been damaged. It does replace them. It creates so-called angiogenesis. It creates a lot of new blood vessels, giving new blood supplies. It's not just anti-aging. There's a lot of tissue healing. So how is Kintaro cell different from the others? We know that embryonic stem cells is an ethical issue. Of course, umbilical cord stem cells is relatively a latecomer in the industry. There are some limitation of harvesting. Adipocyte stem cells, it doesn't work as well as a young stem cells, especially when most of the adipocyte stem cells are older adults. When you do on the autologous, that means we do on our own body. We really need healthy stem cells to be able to do all this work.
I have been searching for stem cell therapy many years ago to compare the healthy and the skin, the bone marrow better than the fast stem cell. I found out the last 2016 that Kintaro manufacture good quality stem cell which has a good potential for anti-aging. This caught my attention for I want to provide a better treatment to all my clients. It's most of my patients, I think 40 years old to and above. I have over 100 patients and over 300 treatment time already who undergone Kintaro cell. Some undergone IV infusion 2-3 times already since last 2 years. I actually tried stem cell therapy using Kintaro cell. I can certify that is very safe. There are no case of ineffective treatment. Most of my patients failed the content and the other decide to undergo another session this year. Based on my experience, it shows a good potential in improving one's health, not only for anti-aging, but also is promising the treatment for today uncurable disease or disorders.